Last week was the official grand reopening of the Northern Lights Regional Health Centre, and we are now joined by Dr. Mador with Alberta Health Services. Let's talk a little bit about, let's start at the beginning when the evacuation initially happened. What was Alberta Health Services' role getting those patients out of the hospitals up north?
Well, it was over 7 weeks now that the mandatory evacuation of Fort McMurray was ordered, and fire was threatening our hospital in Northern Lights. We had over 100 patients there, 70 patients that were acute and 35 long-term patients. And as everyone knows now, we had to get them out of the hospital in a hurry. The fire was threatening, and we safely evacuated them out of the hospital in a couple of hours and to safe havens and onto air ambulance and chartered air flights from Fort McMurray down to Edmonton. Initially, of course, our concern for the workers up there, since there was a mandatory evacuation, was to provide emergency services. So we established an urgent care center, which was able to provide emergency services, including surgery if we needed it. Along with...
Were there surgeries performed during that time?
Fortunately not.
Oh, good.
Right? And so with the emergency services, of course, we had to have enhanced EMS services and air ambulance service from Fort McMurray to Edmonton, which we utilized regularly because there was no place for ill or injured folks who needed care to get that at the time, other than true emergency service. So with the tent hospital that we set up at the Wellness Center in downtown Fort McMurray and enhanced air ambulance and enhanced EMS, we were able to provide service to everyone that was still working up there until we were able to partially open the hospital with the emergency room first at the beginning of the month, and then a couple of weeks ago with some surgery, obstetrical, inpatient capacity, and as of last week, opening the hospital fairly fully. Mm-hmm. And as of Wednesday, we started to see the return of some of our long-term care clients.
Would you say that the hospital is almost back in full working order at this point, or what's still lacking that you're working on getting implemented?
The hospital itself is back to full capacity and full functionality. There are some very specialized services where there will be some delays. For instance, cancer therapy, renal dialysis, but those should be running fairly shortly.
Anything else you'd like the public to know about Alberta Health Services' role for Fort McMurray in the next couple of weeks?
Well, I think the fact that it's been quite a team effort. We've worked with the government of Alberta. We've worked with the regional municipality to try to maintain a level of service throughout the last couple of months that would be able to serve the needs. And we've had a lot of assistance in terms of doing that, and a lot of assistance and support in terms of getting the hospital back into good operations.
Thank you so much for your time. Dr. Mador with Alberta Health Services.